It was actually one of the most curious experiences I had at Idrc, I think, in some ways. Out of the blue one day we got a phone call from the Doris Duke Charitable Foundation. We had to scramble a little bit because I don't think any of us actually knew what the Doris Duke Charitable Foundation was. But it turned out they were a well-established U.S. foundation with major activities in the medical field, but mostly domestically. They were interested in expanding their work in Africa and were really fixed on doing more work around health systems improvements. So we organized a follow-up visit in New York, and I think the interesting part of this was it turned out that the THIP experience was a major factor in this. Elaine Gallen, who was the director of their medical programs at the time, had seen a reference to THIP in a WHO report, I think, or an international report of some kind. In turn, had read the THIP book, had been fascinated by what was going on, and saw that as a basis for recommendations to their board. And in fact, when we met them, she could pull out her copy of the purple THIP book with highlighted passages showing what she had seen. So I think a great experience. In the end, it wound up resulting in a recommendation to their board for a major initiative on strengthening health systems in Africa. They've now approved 5 grants for I think a total of 40-some million US dollars. It doesn't involve Idrc as a direct partner, although Idrc was involved in providing some of the advice leading up to this, but a major investment in terms of health system strengthening and a nice legacy of the THIP project.